Welcome to the Equine Vet Connect podcast. I'm your host, Dan Carter. I'm a veterinarian and a farrier. The goal of this podcast is to educate horse people, break things down, bust myths, and keep it real. Speaking of breaking things down, here's my legal disclaimer to keep my attorney and insurance company happy. While I am a vet, I may not be your vet. Contact them before trying anything you hear on this podcast. Remember, just because you watched it on YouTube or heard it on a podcast does not mean you can do it. Please use common sense. Welcome back to the Equine Vet Connect podcast. I'm Dan Carter. We're here at Countryside Equine Hospital. I got Dr. Caroline Brown back with me today. We're in the old studio, Treatment Room 1. You know, I love this studio.
It's the best one.
Yes.
We've tried filming outside of it, and it just never works.
No, it's
you always come back home, you know?
It was like the LA Forum, you know, where the magic happens. Like, this is where the magic happens in here, so...
I didn't get that reference, but...
Oh, well, so the LA Forum, there used to be, it had the Magic. What was that? There's a basketball team.
Orlando Magic? Yeah.
It was like,
Orlando,
I think it was in LA before it moved to Orlando.
Oh.
And so that was where the Magic happened. So.
Okay.
It was a reference to a movie called The Ladies' Man, which is a spoof off of a Saturday Night Live skit. And I'm probably the only person that ever watched it. We didn't have many movies in the bunkhouse when I lived out west. Like we had like this stack of VHS tapes, and because there was no there wasn't even radio. We didn't even get a radio station there.
You just had whatever VHS.
Yeah, so we had these VHS tapes, and there was one place we could rent movies, still on VHS. Kids used to, you couldn't stream things. You had to like go down to the movie store and
the old
rent the VHS. Yes, and it wasn't even that. It was like a mom and pop, and you could go rent some movies down there. But you know, you had to know you could get to town and get the movie rented. But then somebody had to also be able to get back to town, because this wouldn't like run next door. It's an ordeal. So, but yeah, you had your little membership card. Be Kind, Rewind. So yeah, so it was a reference back to that movie. It's one of the few we had in the bunkhouse. A different time. So, all right, that's our tangent for today. For those of you that knew what I was talking about, thanks for going down memory lane with me, and remember to be kind and rewind. So, all right, so today we're in dermatology land still, because it's springtime.
It is spring.
Yeah.
It is bug season. I've already killed 2 mosquitoes in my truck this week, so it's time to talk about the pests.
Yes, this is the time of year where I don't believe you should ever go south of I-16 because the gnats.
The gnat line. I learned about that. Something called the gnat line.
The gnat line. The gnats have come out. And you don't go south of I-16 because the gnats are out. And we're going to talk about those gnats today. And we're going to talk about bugs. Because I would probably say it's kind of a toss-up. Rain rot, scratches, insect bite hypersensitivity. Based on time of the year, these could all be number one causes of derm issues.
Yes. And a lot of times they're all happening at the same time.
Yeah. I'd probably say bugs, especially insect bite hypersensitivity, number one cause of itchiness, or our fancy word for that is pruritus. Pruritus, which I can never spell that word.
It starts with PR, which is like, It doesn't seem right. It doesn't seem like it should.
No, it should be like a PU, but it's PR, and I always forget the R.
Pruritus.
Yes. I don't know who came up with that word, but I feel like they misspelled it the first time, and now we're stuck having to misspell it forever. So,
probably.
Yeah, pruritus. If your horse is itchy, I'd probably say most of the time it's bugs.
Yep. It is very itchy. It is extremely itchy. We get a lot of complaints of people that their horse has rubbed down the fence, the stall, the trees. They are rubbing their body on literally any surface they can find.
Right. And usually the culprit, it's not the mosquito. It is going to be Culicoides, the biting midge,
the no-see-ums,
the black fly.
Yes.
These little guys, these are the ones that like bite you and you can't see them. That's why the no-see-em thing. They can fit through the screens on your porch. They have the most antigenic saliva of any bug out there. So,
and some horses just seem to be so much more sensitive to them than others.
Well, yeah, because it's almost like people and mosquitoes.
Yes.
Like, I can get bit by mosquitoes, and it's like, it's annoying.
Mm-hmm.
My wife, if there's one mosquito, it will find her, it bites her, and she will itch for days.
Mm-hmm.
Me, it's like, it's annoying, but...
Yeah, but it doesn't, like, yeah.
No.
And unfortunately, too, this is one of these ones that when you see them, it's almost every year they seem to be more reactive to
Right.
it. Like, it just gets worse and worse and worse. So this one is a pain in the butt.
Interesting fact. So the reason they're biting the horse is they're trying to get blood because they need the protein so they can lay eggs to reproduce. So interesting fact, it is only the female no-see-um that bites.
Really?
The males don't bite.
I know that's true with mosquitoes, too.
Mosquitoes.
So,
Most of these flies that actually bite are the female flies because they need a protein source so that they can get the protein they need to lay eggs to recreate.
I didn't know that.
Yeah, so let's talk about Culicoides.
Let's talk about them. So the Culicoides is like what we've talked about, the no-see-ums. They're very tiny. They're blood-sucking insects. They tend to be most active kind of in that early morning to like late afternoon.
Dawn and dusk.
Dawn and dusk. They love standing water. So areas, if you've got ponds, if you've got areas that have poor drainage, they love that. They're very tiny, so they can slip through, normal type of like fly screens and things.
Right.
They can even slip through a lot of like typical fly sheets and things as well, which is also annoying. But they tend to be very weak flyers.
True.
So high-powered fans will actually keep these guys from getting close to them.
Yes.
So that's one of the things that we're going to talk about when we kind of get into management.
One of the things I always tell people, if you wonder if there's Culicoides, if you see your horse like shaking his head, if you see him swishing his tail, if you see them stomping their feet, but you don't see any flies, like you're looking at it, it's like, I don't see any bugs on him, he's constantly moving. He's probably getting, it's probably Culicoides.
Yes,
That's the one.
And like we've talked about, the actual kind of irritant to these horses is their saliva. It's got what's had all the antigens in them. And they tend to affect the neck, the belly, the tail head, their face, a lot of their ears. So these areas are super itchy.
Right, and they're going for areas that they can't be defended against.
Yes.
These things know. They're like, if I get on the belly, that's why if you look, they're usually on midline, and they're going to be up right where the abdomen and the thorax come together, like right there at the rib cage, because there's no good way for the horse to get there with its tail.
Get there.
They can't swatch them off, and these things are, like, they know.
They know exactly where to go.
It's like the ears. Like, how are you going to get, like, you can't defend against the ears. You're like, oh, we'll go there.
Yes.
And these are also areas that are a little thinner skinned. It's
So
like they know.
They know. They're very smart. And these areas start itching. And the problem a lot of times comes where you start itching, and that creates more inflammation in this area.
Right.
And you start what's called the itch cycle, where you itch more, and it seems to be now more itchy. So you're going to continue to scratch. And then now you've traumatized the skin, and that's painful.
Well, and then you traumatize the skin, and that attracts more of these bugs. Because now it's leaking serum, it's leaking even blood in some cases. So they don't even have to really use their proboscis anymore. That's the fancy word for their nose, so they can puncture the skin. They can just show up and like it's there.
It's there, and they work fast too.
Yes.
I mean, these things are like it's so quick that these horses start getting a little itchy, and then all of a sudden you look at them, all their hair is rubbed off.
Right.
Their skin is just like open and bleeding and so painful and red, and over time their skin will get actually like really thick.
Yep.
And it gets a lot harder for it to heal as it continues. I mean, these horses are miserable.
Well, and you'll see it. It's not just where they've been bitten, but it can set up, over time, these systemic reactions. So they may be getting bit on their midline, but it's causing reactions all over the entire body. Like it sets off this whole stream of pruritus where it's just like whole body itches.
Yeah.
We see this down the Caribbean a lot. I work down there, and down the Caribbean, I grew up kind of South Georgia, so I'm used to the no-see-em life, and I'm used to the gnat life. And we think we've got it bad here. You get the Caribbean dawn and dusk. Oh, you know it's dawn and dusk.
Out, yeah.
It's unbearable.
Yeah.
And these things, they're terrible.
And they're also very resistant to a lot of things. So a lot of typical fly sprays, they don't work as well on these guys. I mean, I feel like most fly sprays these days are barely doing the job anyway.
I know.
There's very specific ingredients I feel at work. I mean, at least for me, the no gnat spray is like gold
for now.
For now, yeah. Until they figure out that, but these guys are. When we talk about managing these horses with the sweet itch, there's a lot of things we have to do, and there's kind of two parts to it. So, treating these lesions and trying to control that itch cycle is, kind of step one with these guys. Because again, these guys are itchy and they are probably tearing down your barn and your pasture.
True.
I've seen them where they kind of position themselves over like a low fence or like a bush, and they're just like rubbing up against it like they're doing anything they can to try to relieve it. So breaking up that itch cycle is going to be kind of our main control. So steroids are fantastic for this. We'll, reach for those early on, and there's kind of a lot of things we can do with that. Some of these horses that are really, really sensitive to it, we'll have them on steroids kind of long term, whether that's daily at a low dose, or we'll do, monthly injections of steroids to try to control that itch cycle. Antihistamines can be really helpful for kind of in the moment. If they're going through a really bad flare-up, we'll do antihistamines or sometimes a higher dose of steroids that we'll try to taper back. But that is really kind of our mainstay for at least trying to stop the itch.
One of the things I've seen that's really helpful, Apoquil.
Apoquil.
Now, it's off-label. We still use it in horses. It's a medication used in dogs, but it's actually been really helpful to me to be able to get these horses off of the steroid, because long-term use steroids can be bad.
Sure.
So I've used Apoquil and been really successful getting these horses off steroids. I've tried cetirizine, the Zyrtec.
Doesn't work.
Great on seasonal allergies. Terrible with bugs. I didn't believe the papers that were published, and we tried it, and sure enough, it doesn't do anything for an insect bite hypersensitivity.
No.
So
Benadryl is really the only thing I've had some success with, but again, it's very short term. It's just kind of these ones that are just absolutely miserable and need something. So
the steroid works.
The steroid is
that's the magic. But
sometimes we can get some topical control on these. I've had mixed success with some of our like topical steroids and things, especially these ones that have a lot of like really open wounds that are just kind of irritating them. One of the things we've talked about is the NNBT cream.
Yes.
That we have here. So
and it's the tea that does the magic, I think, on this. It's all about the tea.
All about the tea.
One of the things I focus a lot on nutritional help on these horses. I found like the omega-3s.
Oh, yeah.
High doses of omega-3s have been really, really helpful. Omega-3s focus on two things. One, building up the natural oils in the skin, and I feel like that helps. I don't know if it helps with the secondary response, but they also work on that inflammatory pathway. They start to work up all the way at the level of arachidonic acid. So this is the very top of that inflammatory cascade. But the omega-3s, I'll put these horses on super high doses of omega-3s in their diet. I use a lot of omega horseshine, ground flax. Now, if you're going to use ground flax, one of the things I tell you got to grind it fresh. This isn't something that you can go grind up a month's worth, because when you do that, we're losing those omega-3s to oxidation. You've got to buy a whole flax seed, grind it every day. Good news, you can do that in a coffee grinder. But the omega-3s are super, super helpful because I feel like this is like a multifactorial approach.
Yes.
And so one of the things I really like are those diets high in omega-3s for these horses. I think it really helps control that. Vitamin E, super helpful. And I think that just has to do with overall skin health.
Yes.
It's more, I don't think it prevents itchiness, but those two things also promote great skin health. And I think having good, healthy skin can help with the overall inflammatory response and the overall pruritus. So I will reach for some supplements. And this one time I'm grabbing some supplementation. I'm grabbing some nutritional support. And I think it's really, really important.
Yes, and I think it's kind of important to know too. This is not a one and done situation. These horses, unfortunately, they're going to have this every year.
Yes.
Every year. And so getting their diet under control, getting their environment under control right off the bat is going to be essential to preventing them from getting to that point of being so itchy. It's not going to completely prevent them from getting there.
Right.
But you can at least, mitigate some of the signs and maybe kind of delay that onset of when they get really, really bad.
What's your thoughts? Like, I've had kind of mixed thoughts. I'd love to know your experience on using the hypersensitization protocol, using the shots. I can't remember the company that makes them, but do you have any experience with that?
I've used it a couple times for different things. I've had some that respond very well to it. I have some that don't really respond to it.
That's been
For the ones that it works for, it does fantastic.
Yes.
But I think it really depends on, how well is our environmental management. I think, and we'll get into that too here in a little bit of, you can't just, throw treatment at these guys, whether it's, a steroid or a topical or, the vaccines or anything, without doing some sort of environmental control. And so there's a component with that. And I think it depends too on, what else they are sensitive to. Again, the ones that I've been able to do that respond well, it's great, and we know it works, and they tend to respond for years and years, and we're doing great. Other times, it works maybe for a little bit initially, but it doesn't really continue to work on them for one reason or another. I think it's still an option if we have tried a lot of other treatments and they haven't worked. I think it's still a very viable option. It's not really all that expensive to go down that route. I'm thinking if last time I checked, I think it was about $600 for a 6-month treatment course. So, not too terrible in the realm of,
that's $100 a month. That's most supplements.
Yeah. I was that's, in the realm of expensive horse things. I think that's definitely on the lower end of things, but it's definitely something to talk about. I think one of those things of the more treatment options we have for something, usually the less effective they all are, and we don't really have one good solution. So
yes,
it's this is definitely one of those things that I don't think there's any vet out here that's like, oh man, I love sweet itch, I love treating this. I think this is the headache for every vet in the Southeast. So.
Well, and one of the things you touched on, and I think I want to go ahead and jump into this because I think this is the most important part of solving this issue is environmental management and prevention, because I don't care how much steroid will always win. Or steroid is the main winner in treating this. But if you don't manage the environment these horses are in and try to prevent these bites, even you get enough of them, even steroids can't win. You have to prevent. This is truly where an ounce of prevention is worth a pound of cure.
Yes,
you've got to prevent these bites. So let's talk a little bit. We kind of touched on it about. These are most active dawn and dusk. Dawn and dusk,
yes.
And let's talk about that control.
Yes. So keeping our horses inside during that time to avoid that high activity. So dawn and dusk, keeping them away during that.
Because interesting side note here, these particular bugs do not like to come inside buildings.
No, they don't.
And I don't know why, but they do not like to come inside. They're kind of an outside creature. They don't want to come inside. So right there, just moving them inside can actually prevent a lot of the bites.
Right. And we talked about how, they're they're very tiny, and so for a lot of, traditional insect screens, they can still find their way into barns. Using very, very fine screens can help try to mitigate these things, and high-powered fans in stalls, in barn aisles, all of that, that's going to help tremendously because they're very weak flyers. And so if you have high-powered fans going during the day, that's going to help just try to keep them away.
Wind.
Yes. Any windy day, you're good.
Create that breeze. It doesn't have to be like a huge breeze. You've got to be able to feel it. I kind of judge, like if your hair's moving, that's enough wind.
Yes.
They can't fly through that. And so inside, fans, especially dawn and dusk. That's gonna help. So when you're figuring your turnout schedule, I think it's important to look at your horses that are sensitive to these insect bites and figure out, like, hey, this horse may need to be in. This may not be a great night turnout horse because he's going to be outside when it's dawn and when it's dusk. Now, if you can manage through that, because night turnout, especially down here in the South, we like that night turnout because it's so miserably hot during the day. So having that night turnout really helps.
Yeah, those help. And then avoiding areas where there's water. They love being around water. So if you've got a pond on your property or a stream, even just puddles, like standing water, if like you've got poor drainage, they love that.
Swampy areas.
Yes, they love the water. So trying to keep your horse away from that, and a lot of times it's easier said than done. I mean, horses always tend to find wherever the freaking pond is, and they're like, I'm gonna go stand in that.
They love the wet area too.
They love it. I don't know why. But
you know what's interesting is cedar trees actually help control. If you ever watch your horses, when the bugs are out, you'll find them in cedar trees.
Really?
And cedar's got like a natural insect repellent in it.
Yeah.
And that's why you always see these horses around cedar trees. One of our paddocks here has got some cedars around it, and we don't even have that many bugs in this part of Georgia, but you'll always see them hiding in the cedar trees when the bugs are out. Dawn and dusk, that's where you'll find them.
Interesting. I didn't know that. Sometimes horses are a little smarter than we give them credit for. So
I'm telling you, cedars, if you're trying to get away from bugs, find some cedar trees. So. That's why your grandma had that cedar chest. And she put all her stuff in there. Why? Because there's no moths that were going to attack it, because cedar's it's an insect repellent.
We had a cedar closet growing up, and that's where all the extra clothes went and stuff.
Yes, so, if you're storing clothes, went in the cedar closet.
Yep, no moths.
That's a big thing. Again, Grandma knew. You got questions, ask Grandma.
Yeah.
She knew.
They know. And then, looking at, horse clothes, so your fly sheets, your boots, your masks, all of that, they can be helpful for some things. Unfortunately, with a lot of the fly sheets, the parts that are not covered, the belly, the neck, all of that, that's where these guys like to go.
That's what I tell people. If you're going to use fly sheets, you got to make sure it's going to cover the belly, the neck, and also the legs.
The legs, yeah. And fly boots are great. I
love the fly boots. They look ridiculous. Kind of looks like an upside down traffic cone on the legs. Fantastic for fly control. Yes. Fantastic.
They're neon, so that when they go and throw them off into the pasture, you can actually go find them later. So
yes. And they've done a great job. You've got some of these are impregnated with citronella oils, and that helps. And that's what I've noticed, like citronella, if you're going to use some kind of repellent, something with the citronella seems to work the best. Problem is, it's a constant reapplication.
Yes.
It's constant reapplication.
So, if you're bougie and you can get your barn to do the automatic spraying during the day, that's going to help. But, there's a lot of different types of fly control out there, and, some of them are good, some of them are not so good. Permethrin is kind of our ingredient that seems to be the most effective with getting rid of things. 1% to 2% is going to be kind of your like sweet spot for actually working. Most of these commercial fly sprays are not that. So, if we want to get to that point, diluting them down from the concentrated is going to be, your best bet for that. But, trying to control the environment is so difficult.
Well, remember too, a lot of people, they get concerned, rightfully so, about putting chemicals on everything. But permethrins are actually, I think it's the extract from a chrysanthemum plant.
Sure.
I feel like it's the extract from a chrysanthemum, because it's actually a natural compound. But the permethrins that's usually my go-to. Some of these other ones can be kind of harsh.
Yeah.
And then a lot of people like to use the oil bases, to see if they'll last longer. I haven't. The ones that say 24-hour fly control, no.
No.
I have not seen this.
There's a lot of feed-through fly controls, too. I've had some about garlic or something, feeding your horse garlic.
I haven't seen that really help.
I don't think that does anything. April is shaking her head no.
Yeah. I've seen it try. I've not seen it be helpful. It just makes the barn smell bad.
Yeah, I was like, it just makes everything smell like garlic.
Yeah. So the biggest thing I would say is dawn and dusk, get your horses in a barn, get some fans on them, get some air current moving, create a wind tunnel in the barn, create a wind tunnel in the stall, get that air moving, and that's going to be your prevention. You're going to minimize how many bites your horses get.
Yeah.
And if you are getting the bites and you're having their activity, get a hold of your vet, start figuring out what plan is going to work. So,
and I think too, talking about the most important thing, kind of wrapping up this topic, is that this is not a cure-all. This is not a one-time we fix it and then we never see it again. This is going to be something super chronic. It's very difficult to prevent your horse from having any lesions at all. So, just trying to make it the most, make them the most comfortable that we can, try to do everything we can to manage it, but we are not going to fix it 100%.
No.
But so that's just kind of setting that expectation for it.
And I tell people this too, when you move to the South, like we get people that move here from California, we get horses that come in from California or the Northeast, or we get imports that come in from Europe. They've never seen bugs before.
Oh, they tend to be the worst.
That first year is rough.
Oh, yeah.
And, I try to, if they can, like, I always joke, like, I always, this is my theory according to Dan, if we can get those horses here in the fall, let them go through a little bit of misery that fall, not get too aggressive too quick. To see if we can build that tolerance, to build that sensitivity, and let the body stop right. It's almost like a natural hypersensitization protocol. But usually that first year your horse is here, that's going to be the worst.
Yes.
If they've never seen it. A lot of times the next year's not so bad. So, but yeah, if you're considering moving to the Southeast,
be prepared.
Be prepared. This is, everything wants to bite down here.
Yes.
So,
yes.
Yeah. Let's talk about another one. This is a fun one. This one's really cool. Old summer sores, cutaneous habronemiasis.
Never heard of this until I moved down to the South, and I said, what in the world did I get myself into?
Yes.
Like, this is like almost out of a horror movie. Like, if you're not from the South and they're like, what the heck is this?
Yes.
But cutaneous habronemiasis. So, a summer sore, if you know, you know. So what this is actually, we're going to kind of cycle back and talk about bots, which I know we've talked about in a couple different episodes. So, our black flies are carrying a bot larvae. And there's a whole life cycle of this, which I'm sure we've gone into many a time. And normally they need to go through this horse's stomach, reach their maturation cycle, and then, be defecated out, hatch, turn into flies, go on about their life. Well, what happens is that these larvae, get a little sidetracked, and these black flies accidentally end up depositing them into a wound.
Yes.
And most of the time we're seeing those on the legs. Sometimes they'll happen on the face. A lot of times they'll happen on their genitalia. They get a little rogue, and then these larvae can't complete their life cycle here. They're kind of stuck. And the body doesn't like having them there.
No.
So the body creates this massive inflammatory response to these larvae laying in their skin.
Yep.
And that creates the summer sore.
Yeah, these, when we say inflammatory response, it is in true horse form, this is a gross overreaction. And the larvae itself isn't that big of a deal.
No.
The horse, really overreacts to this thing.
They are itchy.
Yes.
It is proud fleshy. it is just this big, red, nasty, just thing.
What I typically hear, the phone call comes in, my horses, usually because they love to get down around the coronary band, the lower leg, like fetlock down, and they're like, something just exploded on my horse.
Yeah.
And it came out of nowhere. It wasn't there Monday. Today's Wednesday, and it looks like there's this explosion on my horse's leg.
Yeah.
And that's true. Like, it literally looks like an explosion, and that's this huge overreaction. And like I said, the number one key here is they look for breaks in the skin. And you may not even see this tiny little break in the skin. But you got a little break in the skin, and these larvae get deposited there, and it just goes haywire from there.
Yes, and these kind of typical things, they're usually very proud, fleshy looking, so they're like pink and gross, and they're usually oozing, and sometimes you can see them. They have these little tiny granules within the skin. That's kind of our characteristic. You can't always see them, but when you see them, you're like, yeah, that's sulfur.
They call them sulfur granules.
Sulfur granules, yes.
Because it looks like a granule of sulfur. And so they call them sulfur granules. And one of the places, this leads to, like, sometimes they'll deposit, because that fly is looking for someplace moist, and they love to deposit in the corner of the eye.
Yes.
And you actually get what's called a dacrocystitis.
Oh, there's a word.
It's over there by where the tear duct is, and you'll see this thing, and you can actually push on it, and you'll get these sulfur granules that pop out, and it's called a dacrocystitis.
Oh,
so it's
there's your vocab for the day.
I know, I love that word.
Dacrocystitis.
But yeah, the south, you're going to see this most in the southeast, and when we're really going to see it is drought-type conditions. So when we're having those July, August, where you can't buy rain, drought type conditions, and I think that the flies are looking for any place they can find moisture, and that's why these get deposits. So they're looking for those where the eyes are excess lacrimation, where they've got a little bit of moisture there, breaks in the skin where they can find some moisture. They're there, and like I said, these can, and I've seen them, like, the other thing is, like, desert, like if you get out into like Arizona, New Mexico, Southern California, these things can get massive. Like, really? Yes, in these drought type areas, I've seen some massive habronemiasis out there. So it's pretty incredible. Yeah. So. And these things require very aggressive treatment. They are, very rarely is this another one and done type treatment. You know, we're usually doing a combination of surgical removal if we can, topical, we're deworming, and we are, just being super aggressive with these guys because they will come back yearly. I was gonna say the horses that have an issue with this, they always have an issue. Always, and they'll come back in the same spot every time. Every time, and it's nuts. It's crazy. And I'll tell you, the good thing is like ivermectin does a really good job of killing these, but you still have to deal with the inflammatory response. Yes. Because even though you have killed this parasite, you still have it in the body. It's still in that wound. And then the body is still overacting. In fact, sometimes we'll kill it with a dewormer. So we'll kill it with ivermectin. And it actually temporarily gets worse. Yeah. And this is why we have to go in and debulk these. Because it's such an inflammatory response that we have to go in typically and remove these large areas of the summer sore. And I mean, I have had them as big as, I've seen them as big as softballs growing off the fetlock. I had one off a hawk. It looked like a volleyball. Yeah. I mean, it was massive. And and that's why it's hard, because a lot of times where these things end up are not places that you can just hack them off. Yeah, they love to get around joints for some reason. Yes, you can't just go slice it off. It's something you're like, well, we're going to have an open wound, which is, that's another, that could potentially be another summer sore that comes in. Yes. So. And that's why when we do take them off, I cannot stress this enough. Keep it covered, keep it covered, keep it covered. If your horse has a wound, keep it covered. Yes. Keep it covered, because I've seen very simple wounds just turn into big summer sores. We talked about it earlier, those leg boots, the little upside down looking traffic cone things, those are fantastic because it keeps the fly off of that. So if you just have a small cut, you don't necessarily have to wrap this up in a standing bandage, but just keeping that keeping those fly boots on to keep that covered works fantastic.
Yes.
So another thing we typically have, a lot of times we have to do is inject these. I'll use a lot of steroids intralesional. I'll inject these summer sores with a steroid locally, trying to calm that inflammatory response down. But again, it's usually a multimodal approach where we go in, surgically debulk it, take as much of this off as we can, and then I'll start an intralesional steroid to try to get this under control. At the same time, I am using the heck out of a dewormer.
Yes.
Because I don't want this to get a new parasite in there.
Yeah, when we say heck out of a dewormer, I mean, we're talking like every 2 weeks.
Yes.
We are hitting them with a dewormer for usually the duration of fly season.
Right.
Because this is a very seasonal thing. And so one of the things we will hear is that these horses that get these, even if we're not really doing aggressive treatment, they'll regress during the winter. It's like something about that first freeze, and it's the body's like, all right, we're done.
Yes.
And they'll kind of taper off, and we'll forget about them. But then springtime rolls around, and all of a sudden they explode again.
Well, and that's the thing is, we have these new deworming protocols that are fantastic about only using dewormers when we need to. And one of the things I have to remind people of is that's for the control of small strongyral cyatostome. That's what that program's developed around. If you have a horse with habronemiasis, again, we're not overusing that dewormer. We're using it to treat an actual problem.
Yes.
So, yes, we may end up with some resistance from a cyatostome problem, but at that point in time, I'm choosing to get rid of this habronemiasis over my cyatostome, and that's going to fall back to I'm going to try to breed. I'm just going to hopefully I can breed out the cyatostome issue. So, again, talking to your vet, like this is something we're going to look at, and a big thing to me is if I have a horse that I know gets these, and I know starting in May, that's when this horse starts to get infected. You know what? Starting in April, we're starting a deworming program tailored to try to prevent this habronemiasis. So I'm going to start a few weeks out because I don't want to wait till I have the problem. I want to be starting a few weeks before, and we're going to get on this ivermectin, and we're going to start controlling it then. We're going to start our control methods with keeping things covered. We're going to start looking at those fly boots because, again, they love to get the lower legs. We're going to look at fly sheets because, again, these are bigger flies, so they can't get through the mesh. So we're going to start looking at fly mask up around the eyes. We're going to start on this deworming protocol. We're going to remember if this horse gets an open wound, we're going to remember this horse has got an issue with habronemiasis. We're going to treat it differently than we will a horse that doesn't. So... And I think that's a good point, too, to remember is if a horse has habronemiasis is not necessarily a barn issue. Just because a horse has it at your barn doesn't mean your horse will get it. It seems to be an individual horse sensitivity.
It really does, because it's like you see these horses that they just tend to get them, and they tend to get them every year, or they just get a bunch of them. And then you have other horses that they're like, I've never seen this problem in my life.
No.
And they'll never have it.
And here's the deal. If you're in Georgia, this flies everywhere.
Everywhere.
It's not like you can move barns and this fly will go away. It's everywhere. So it's not like you can move and get rid of it, but you're going to be like, you're changing states.
Yeah.
You're headed.
You're headed out west.
You're headed way north. You're headed to
Yeah.
where they get that white stuff on the ground. That seems to be how you can get away from it.
Again, I grew up in Illinois. I never heard of this until I moved down here. I was like, this is horrible. This is terrible. Why did I move here?
We can grow some bugs down here.
Pythium is another one that's like real scary that you're like,
Yeah.
swamp cancer, what's that?
Yeah, that's a whole nother topic.
that's like a whole podcast in and of itself.
Yeah, Pythium's a whole, because it's interesting because it's hard to differentiate between Pythium and habronemiasis. And one thing too is if you're suspect and you're not sure if it is or not, and there's times we're going to look at it and we're like, well, it looks a lot like habronemiasis, but it may have some other characteristics. We may be grabbing for that biopsy and letting the pathologist tell us for sure. So, and again, prevention. And unfortunately, if your horse, like let's say the first time they get it, and we don't notice it until they got it, I hate to tell you this, but you're living with this till this fly goes away. I've never healed. I'm sure somebody somewhere that's smarter than me has been able to get one to heal, but I've truly never gotten one to heal all the way until it gets cold.
Yeah, during the fly season, they don't. Yeah,
I'm just going to fight this.
Yeah,
like we're going to try to manage it. We're going to try to keep it at bay. I'm probably not curing this thing.
No.
So again, trying to control
the parasites around your property, I think, is another one that, environmental management is just so important.
Getting rid of, because wet areas do seem to attract them more. Mm-hmm. But again, we see this mostly in drought conditions. Mm-hmm. But I still think trying to control standing water,
keeping your stalls cleaned, just hygiene, even just, keeping up with your regular deworming protocol.
So I still think, in managing the fly situation around the farm, trying to minimize your fly populations, this is going back to good manure control.
Yes.
Keeping manure up, trying to, composting manure well, or moving manure off the properties. Mm-hmm. Things that we can do from a fly control perspective can help minimize the number of these black flies that are spreading this. But again, this is where you really want to work with your veterinarian, because we're going to manage it through that first year. And then the following year, we're going to get on a prevention. And again, this is good records. If we typically see it on your farm in May, we want to start in April. If we see it in April, we want to start in March. If we know we've got drought type conditions coming, we want to be on the lookout for this. We want to remember these horses. We've dealt with it, and it's usually pretty easy to remember.
Oh yeah.
And again, we want to know when it showed up, and we want to start early trying to prevent this if we can.
Yes.
So one of the things to look at too is if you have a horse that you've purchased, one of the things that you can look at is if you see a lot of scars around the pastern, scars around the fetlocks. Because a lot of these horses have had chronic habronemiasis, their skin never comes back together. Mm-hmm. And so if you've seen this and you've got these type of things like on the pastern and on the fetlocks, that seems to be the two most common places, you want to watch these horses closely, because that can be an indicator they've had issues with habronemiasis in the past. Mm-hmm. So really want to watch these.
Because these things will almost completely go away sometimes in the
wintertime, yes.
Like, you'll have these ones and they're just god-awful ugly in the summer, but then, 6 months later, in the dead of winter, it doesn't look like there's anything there. Or it's, just a tiniest, like it looks like a little scab of something, and you're like, oh, okay.
And
you would never know. If you took this horse and put it somewhere else with people that, have never seen it before, they would never know that, this thing had Goliath on it 6 months ago. So.
Yep. So, controlling the flies. And also remember, too, we should have brought this in. We're talking about treating these. Let's say we go in and we do debride these. We put the steroids in. We're making progress. This is one of those that you cannot stop as far as wrapping. You've got to wrap to the bitter end. You may be down and it's a tiny little pinhole. Keep going. Keep going.
Yes.
Because all it takes is one fly dropping off one larvae, and this whole process starts over again. Mm-hmm.
Yeah. When we say aggressive treatment, we mean aggressive. And we're looking at these every couple of weeks when we're actively dealing with them. It is not a one and done, you hack it off or you inject it once and then you're home free. No, we're dealing with these things.
Scorched earth.
Yes. And then scorch it a little more.
Yes. So, all right. Well, that's some pretty cool stuff today. Bugs. If you live in the Northeast, you probably don't need to listen to this.
Yeah.
We've probably scared you of ever moving to the sunny South. It's a great place, but bugs are.
Well, when you think about it too, a lot of the big show seasons down south are in the winter, so they don't even know.
No, they have no idea.
They don't have. Lucky you guys.
Yes, it's the summertime and bugs. Coastal states.
I don't think there's really any other species that get summer sores either. I think it's truly just a horse being a horse, and
I think so. It's again overreacting.
Yeah, the horse immune system is really just amazing. They're just so good at just having inflammatory reactions.
Love an inflammatory reaction.
They love it. It's like their second favorite thing to do.
Yes. It's like I'm like guarantees I'm gonna colic and my immune system will overreact to something, and I'm gonna limp.
Yeah.
So, but yep. So moral of the story today, if you get any takeaways from today, is control bugs, control bugs, control bugs.
Yes.
So,
yes.
And like I said, if you need help, talk to your veterinarian. Like we're more than happy to talk to you, because our whole goal is to try to prevent these, because we always feel like failures when we're treating them, because we don't feel like we ever win. So if we can help you prevent this, we're all about it, because we're gonna look at you when you have these pop up and like, so we're not gonna win this till it gets cold and the bugs go away, and so we're gonna be seeing you a lot this summer. We're gonna fight this all summer. So we're going to set up a plan. We're going to try to prevent bugs, and prevent bugs.
One day when we get the miracle cure for this, we'll circle back and
I am ready to find it.
We'll talk about it again.
Yes.
And I'm going to buy in on it. Get me on that patent.
So, well, thank y'all for tuning in again. And Dr. Brown, thanks for being here today. April, thanks for recording all this. Casey, thanks for doing the editing. If y'all ever saw one of these podcasts that was live and uncut, you'd understand just how much work Casey has to do, because, there's a lot more to podcasting than most people realize. But we have a great time doing it. Really enjoy this. It's really helpful for us. So,
it is.
We got some great listeners. They keep sending in topics. Guys, we're working on these topics. Like I said, we got 2 whiteboards now covered up with topics. Keep sending them in. We're going to keep getting to them. I know, just be patient with us. There's only so many of these we can record, because we do have real jobs. We do have to go be veterinarians. So there's only so much time we got, but be patient with us. We're going to keep getting these recorded, keep sending them out. Like I said, if you got some ideas, give us a call, send us an email, shoot us a text, talk to us in person, DM us, send a carrier pigeon, however you want to communicate, send it on. So, speaking of flies,
it's just been like circling me the last 5 minutes. I'm like, I can hear it. It's like a bomber plane just coming at me.
It is time. They are out. They are alive and well. We have a lot of fly control around here.
We do. Yeah.
We're like zero tolerance bugs, but yet we still have these.
It's that 1% that's just resistant to everything, and they're here and they're looking at me. It's sitting on the light right now, and I can see it just mocking us.
I'm telling you. So thank y'all for tuning in. We really appreciate it. We'll see y'all next week.
Bye, y'all.